Calvin Richardson Jr. always wanted to serve, even after retiring from the Army.
He was always protective of everybody.
He signed up to work at the VA. His mom said he turned down a higher paying offer at agency headquarters in Washington to work a few miles down the street at the D.C. VA Medical Center, helping rehabilitate vets who suffered addictions.
He knew the work, and he understood the veterans.
But at the outset of this outbreak, Calvin knew his pre-existing health conditions put him more at risk of dying from complications of coronavirus, according to his mom. By early April, she said Calvin was told by the medical center he'd been exposed and needed to go into a 14-day quarantine.
That was my biggest fear.
She told the I-Team Calvin was called back to work after just 5 days, even though he had symptoms by then.
He was sick. He had a fever, and he kept going. And I said, well, what are they saying to you? He said, they told me I'm okay.
Within a few more days, on April 10th, his mom said VA hospital staff tested Calvin for COVID-19, and it was positive.
Why would they call him back to work and allow him to work there with others with a temperature?
They hospitalized the 57-year-old April 12th.
His wife took him to the hospital on the Sunday, and he was dead by the end of the week.
But our News 4 I-Team investigation found Calvin Richardson's relatives aren't the only ones who've issued complaints. There are other VA workers who say they, too, were pushed to come back to work too soon after health scares. Another D.C. VA Medical Center worker who asked for anonymity said he requested to work from home or take leave, worried he was at risk because of pre-existing conditions, too.
I would think that would be a lot better than having everyone there at the hospital.
40% of workers at the hospital are teleworking now, and this employee said he asked to telework too, but was rejected, even though he said his job is not in the emergency room and was not essential.
People sit there not doing anything. They're just sitting there, basically waiting for someone to come.
He decided to stay home anyway and said his bosses ruled him to be AWOL, absent without leave. For the feds, AWOL is considered misconduct and subject to disciplinary action. Calvin Richardson's mom said when her son sought to use his vacation time before falling ill, he too was told he'd be considered AWOL.
To a military man, AWOL is something that they don't want to, be listed as.
In a statement, the VA told the I-Team employees who test positive are given sick leave and can only return after they've been asymptomatic for 10 days or at least 3 days after recovery, and that those who think they've been exposed can apply for paid sick leave too. The agency says it cannot respond to specific questions about Richardson's case.
It's not altogether clear how well they have been following through.
In a letter to the VA obtained by the I-Team, the U.S. House Veterans Affairs Committee says there are other cases of VA workers nationwide who report being denied paid leave and others being denied requests to telework. Even though policy allows it, the committee is investigating whether individual managers at some hospitals are denying it to workers anyway.
We're hearing from different quarters of the VA that these policies are inconsistently applied.
Our I-Team review shows the number of VA employees who've tested positive is steadily rising. 1,400 nationwide, at least 54 at the D.C. VA hospital. Doris Richardson says she hopes her son's death has convinced agency officials to consistently follow those policies and offer telework to as many workers as possible.
His dedication was what really brought him down.
To ensure employees who want to protect their jobs and help their patients aren't putting themselves at risk doing so. Scott McFarland, News 4 I-Team. 4 months ago, coronavirus transformed one of America's largest veterans hospitals here in the district. Patients screened outside before entering. Visitations limited at the D.C. VA Medical Center. As case numbers have fluctuated, some restrictions have too. Elective surgeries have resumed, and plexiglass is installed in clinics. COVID-19 testing is performed inside with results within a day. But this longtime medical center employee said he's never been more worried.
I'm 63 years old. I have been now diagnosed with diabetes. So I'm very concerned about working in that hospital.
He asked we not show his face to prevent possible retaliation. He and a half dozen other employees told the News 4 I-Team they're fearful colleagues are showing up for work sick, including one worker who said he tried to take sick leave after developing a low-grade fever but was denied and worked at least one full day before testing positive for COVID-19.
I don't understand that concept. Everyone in the hospital should be able to protect themselves.
Another said his request to go home was turned down as he awaited the results of his test after being potentially exposed to a sick colleague because he was already out of sick time.
You don't know how this thing is, creeping up on folks. We don't know how to protect ourselves.
This worker told the I-Team he was denied the hospital's approval for a test altogether because it was determined he wasn't in close enough proximity to an infected person. You worked with somebody who tested positive and you couldn't get approved for a test by the VA.
By the VA.
The union for many of the frontline workers said they face a difficult choice: show up or don't get paid.
Even people who they knew were sick, who have ran out of leave and asked to use annual leave in lieu of sick leave, they were denied that, so they had to come back to work.
If you put me in a situation where I don't have money, I have no other choice than to risk my life and my children's life to come to work because I got to pay my bills.
An I-Team review of agency records shows at least 66 employees have tested positive so far at the DC VA Medical Center out of the nearly 2,000 who work there.
If we have an employee who has a known exposure to somebody who is COVID positive, then we're going to test them if they request testing.
The medical center director told the I-Team workers are being offered leave, but he acknowledged decisions about who gets approved for paid leave amid this crisis are made by lower-level supervisors in his hospital, and that those leaders must have discretion to keep the hospital functioning.
Our supervisors are balancing the risk to our staff as well as the mission and the responsibility we have to the veterans that we care for. And that doesn't necessarily align with every individual's employee's desire on how to do their job.
Well, the medical center and the union agree the hospital is getting test results back to workers more quickly now, but the turnaround time was slower in April. And the News 4 I-Team found for at least one worker, the wait turned out to be more than just stressful.
He says, well, I want to use my vacation time. He has lots of time. And they told him no.
Doris Richardson's son, Calvin, was an addiction rehab specialist at the facility. She says earlier this year he was quarantined after possible exposure to the virus while working, only to be called back to work after a few days.
He was there, and it's a possibility that he was infecting other people. You know, that's concerning to me.
He eventually tested positive, was hospitalized, and died a week after Easter. The medical center director told the I-Team he's never heard any issues from the union about testing and that results are now coming back within 24 hours. And there's been progress in approving more telework for employees.
We go out of our way to make sure we're keeping our staff as safe as possible.
But as hospitals try to return to a more normal workflow, employees tell us they're worried there'll be more pressure to deny leave.
If they send us home, then who's going to be on the front to actually do the work?
A balancing act to keep serving veterans, even as fear continues among those on the front lines. Scott McFarland, News 4 I-Team. Last week, we told you some VA workers, including here at the hospital in D.C., say they've been rationing masks, reusing the same masks for up to a week, and some sharing face shields. Now, members of Congress say they may need more supplies and some more help in the VA system. Nearly 50 staffers at the Washington, D.C. VA Medical Center have tested positive for or been possibly exposed to coronavirus and isolated themselves. Some have recovered, but one of them has died. Calvin Richardson Jr., a 57-year-old addiction rehab specialist. In the past week, several employees and the national union representing VA workers told us they're concerned they've been asked to reuse masks for a week and store them in a paper bag. The memo detailing it was shared with the I-Team.
It should be unacceptable to any American. I mean, these are the same people, that had to care for our veterans.
The VA showed us they have a range of masks, from paper or cloth for some to N95s for those on the front lines in hospitals, and they say all federal health guidelines are followed to protect workers. But local members of Congress say they're growing concerned about the VA supplies, too.
I don't think they've been very forward-leaning on making sure the workforce feels like they're getting adequate supply. When somebody's told you got to reuse a mask all week long, I'm not sure that's safe.
U.S. House Majority Leader Steny Hoyer tells us Congress might have to consider new funding for the agency to help at its 100-plus hospitals nationwide.
We know that many veterans who are in our veterans hospitals are older. We know that they're most at risk. We owe it to our veterans to make sure that we have the resources to take care of their needs.
The agency has acknowledged it must compete to buy supplies at a time of great demand. In the meantime, nationwide, the VA tells us it's rapidly increased its telehealth services for veterans, up more than 200% this month. That helps reduce the number of patients workers must see in person and limits exposure for all. And these supplies take on added importance at the VA system. The U.S. Department of Veterans Affairs has what's called a fourth mission. They're the emergency backstop if private hospitals get overrun by patients. They'll need extra beds and extra supplies even for non-veteran patients if hospitals locally do get overrun. Scott McFarland, News 4 IT.